Good morning, everyone. My name is George Paiba, and I am delighted to co-present with my colleague, Christine Montagna. So, we are both registered nurses and currently pursuing our Master of Science in Nursing. So, over the next 20 minutes, we will take you on a journey through modern diabetes care, from empowering self-management to cutting-edge pharmacotherapies and a cautious look at complementary approaches. By the end of the presentation, you will be able to first master the ADCES7 self-care behaviors that form the foundation of sustainable diabetes management. Second, review the latest SGLT2 inhibitors, GLP-1 receptor agonist, dual agonist, and the exciting 2026 breakthroughs such as once-weekly insulin icodec and the new oral GLP-1 or forglipron. Third, critically evaluate the evidence, benefits, and safety consideration of promising herbal medicines used as adjunctive options. And finally, apply a multidisciplinary patient-centered approach that integrates education, evidence-based drugs, lifestyle modifications, and informed complementary strategies. So, let us begin by understanding the global challenge that diabetes present to healthcare systems and individuals worldwide. Diabetes mellitus, primarily type 2 but also type 1 and other forms, is a chronic metabolic disorder characterized by hyperglycemia resulting from insulin deficiency, resistance, or both. Effective management requires a multifactorial approach that integrates self-care education, evidence-based pharmacotherapy, lifestyle modifications, and when appropriate, cautious complementary strategies, all under personalized medical supervision. The numbers are staggering as a recent global data, 537 million adults are living with diabetes worldwide, with 6.7 million deaths directly attributed to the disease each year. More than half of the patients with type 2 diabetes also face elevated cardiovascular or chronic kidney disease risk. This presentation emphasizes empowerment through knowledge, modern therapies with proven cardiorenal and weight benefits, and a balanced evidence-based perspective on herbal approaches. Technology and the new drug classes have truly transformed outcomes in the last decade. Self-management education and support, or DSMES, is an evidence-based ongoing process delivered by certified diabetes care and education specialists, including nurses, dietitians, and pharmacists. It equips individuals with the knowledge, skills, and confidence to manage their diabetes daily. Research consistently shows that effective DSMES can lower A1C by 0.5 to 1% or more, reduce complications, enhance quality of life, and lower healthcare costs through fewer hospitalizations and emergency visits. The core framework is the ADCES7 self-care behaviors. So let me briefly walk you through each. Healthy coping addresses the emotional burden, stress, diabetes distress, depression, and burnout. Using mindfulness, support groups, and cognitive behavioral strategies. Healthy eating focuses on personalized nutrition plans with carbohydrate awareness, fiber-rich foods, and cultural preferences, often guided by continuous glucose monitoring. Being active recommends at least 150 minutes per week of moderate aerobic activity plus resistance training, tailored to individual complications. Taking medication emphasizes adherence, understanding mechanisms, side effects, and proper storage. Monitoring involves self-monitoring of blood glucose or CGM for pattern recognition and safety alerts. Reducing risk covers foot care, eye and dental exam, vaccination, smoking cessation, and recognizing warning signs of acute issues like DKA or severe hypoglycemia. Finally, problem solving equips patients with skills or sick day management, travel, dining out, and using data to make informed daily decisions. TCSMES is recommended for all people with diabetes at diagnosis, annually during transition or with complications. Technology has transformed diabetes healthcare from reactive to truly proactive management. Continuous glucose monitors such as Descom and Freestyle Libre provide real-time trends, directional arrows, and customizable alerts, allowing patients and clinicians to make data-driven decisions 24/7 instead of relying on sporadic finger sticks. Automated insulin delivery system, often called hybrid closed loop or artificial pancreas technology, including Control IQ and Omnipod 5, integrates CGM with insulin pump to automatically adjust basal rates, dramatically improving time in range and reducing the burden on patients. Smart pens, AI-powered coaching apps, and digital health platforms now track doses, offer predictive analytics, and enable remote provider monitoring. Telehealth and remote patient monitoring have expanded access, especially for rural or mobility limited patients, and have become essential post pandemic. These tools make self management more precise, less burdensome, and more sustainable. Since 2000, diabetes treatments has shifted dramatically from older glucocentric agents like metformin and sulfonylureas to therapies that offer multifactorial benefits: superior A1C reduction, significant weight loss, cardiovascular risk reduction, including MACE and heart failure, kidney protection, and improve convenience with oral options and weekly dosing. These address the cardiorenal metabolic syndrome common in type 2 diabetes. Core treatment principles today, including metformin, remains foundational for many patients. We escalate early with SGLT2 inhibitors and or GLP-1 based therapies for their proven cardiorenal and weight benefits. We combine classes for synergy, and we focus on holistic outcomes: A1C weight, cardiovascular and kidney risk, and quality of life. The pipeline emphasizes orals, weekly options, and multi-agonists. 2026 brings particular exciting milestone that we will highlight shortly. So the SGLT2 inhibitors, first approved in 2013 and onward, it represents a paradigm shift. So the key agents include empagliflozin or Jardiance, dapagliflozin or Farxiga, canagliflozin, Ingoncana, and ertogliflozin. They work by blocking the sodium glucose cotransporter 2 in the kidneys, promoting glucosuria and natriuresis. Their benefits extend far beyond modest A1C lowering of about 0.5 to 1%. They provide strong cardiorenal protection, reducing heart failure, hospitalization, cardiovascular death, and a CKD progression. Even in people with diabetes, they also offer modest weight loss of 2 to 3 kilograms and blood pressure reduction. Considerations include genital mucolytic infections, urinary tract infections, and volume depletions, and rare euglycemic DKA. These agents are often first or second line add-ons, especially for patients with cardiovascular disease, chronic kidney disease, or renal failure. GLP-1 receptor agonist has been transformative. Semaglutide, which is Ozempic injectable since 2017, and Rybelsus oral since 2019, delivers robust A1C reductions of 1 to 2% or more and substantial weight loss of 5 to 15% or greater of body weight. Along with cardiovascular risk reduction, dulaglutide or Trulicity offers convenient weekly dosing with strong outcomes data. Liraglutide and lixisenatide provide daily options. The 2026 milestone is truly exciting. Orforglipron brand name Fundayok, approved by FDA on April 1, 2026. This is the first non-peptide oral small molecule GLP-1 agonist. It can be taken any time of the day with no food or water restrictions, a major advancement for adherence. It has demonstrated strong weight loss efficacy in trials and is highly relevant for type 2 diabetes given the obesity overlap. This represents a significant step forward in convenience and acceptability. So the next generation incretins are pushing boundaries further. Tirzepatide or Mounjaro for type 2 diabetes, Zepbound for weight management, a dual GIP GLP-1 agonist approved in 2022 has grown superior A1C lowering of about 2% or more and weight loss of 15 to 20% or greater in trials compared to semaglutide with an excellent emerging cardiovascular and renal data. Pipeline agents like cagrisema or cagrilinotide, semaglutide, promise even greater weight loss, while retatrutide, a triple agonist, is an advanced trials with potential for substantial weight loss and muscle reservation. On the insulin front, the major 2026 breakthrough is insulin icodec or weekly, approved March 26, 2026, the first once weekly basal insulin in a U700 Flex Touch Pen. It dramatically reduces injection burden from 7 to 1 per week. The onward clinical trial program demonstrated non-inferior or superior A1C control with manageable safety when properly titrated. Biosimilars and connected smart pens integrated with CGM and AID system are also improving affordability and outcomes. So, for type 1 diabetes, we are seeing the dawn of disease-modifying therapies. Teplizumab, known as SILD, is a monoclonal antibody that delays progression to stage 3 type 1 diabetes in at-risk individuals by preserving beta cells function. This is the first disease-modifying therapy approved for this indication. Lantindra or Donis-Lazel is an allogenic islet cell therapy for adults with type 1 diabetes and severe recurrent hypoglycemia despite intensive management. It offers the potential for insulin independence through a one-time infusion. Also, core treatment principle for the 2020s and beyond remain. Metformin is foundational for many with type 2, escalate early with SGLT2 inhibitors and GLP-1 based therapies for cardiorenal benefits, combine classes for synergy, and focus on A1C plus weight, cardiovascular and kidney disease risk, and quality of life. The future holds precision medicine, stem cell derived islets, fully closed loop systems, and equitable global access prevention through lifestyle remain foundational. So, thank you. At this point, I will hand over to my colleague, Ms. Christine Montagna, who will present the section on herbal medicines, our integrated patient centered approach, key takeaway, and our closing remarks.
Thank you, George. Good day, everyone. To continue, herbal and traditional medicines have been used for centuries in Ayurveda, traditional Chinese medicine, and folk practices for what was once called sugar disease. So modern interest focuses in bioactive compounds like polyphenols, flavonoids, alkaloids, and fibers that may offer antioxidant, anti-inflammatory, insulin sensitizing, or carbohydrate absorption inhibiting effects. However, the evidence is preliminary to moderate at best, and these should never be considered as substitute for proven therapies. Promising agents with supporting evidence from meta-analysis and randomized controlled trials include fenugreek seeds, rich in soluble galactomannan fiber, have shown significant reductions in fasting blood glucose and HbA1c of about 0.8 to 1%. Cinnamon polyphenols may enhance insulin signaling with modest fasting glucose lowering in some trials. Also, bitter melon contains carotene and polypeptide B that may mimic insulin, though human trial results are mixed. Another one is berberine from berberis and coptis plants, which activates AMPK similar to metformin and has shown consistent glucose lowering and lipid improving effects in trials. Additional agents with positive signals include aloe vera leaf gel or extract, where meta-analysis indicate notable HbA1c reduction of about 1% when used adjunctively. Curcumin from turmeric offers anti-inflammatory and antioxidant effects with modest benefits in glycemic and complication markers. Another one is Nigella sativa or black seed, with its active compound thymoquinone, shows positive signals in glycemic control and lipid trials. Psyllium fiber supports postprandial control, while ginger and American ginseng have emerging traditional use data. Typical effects across these agents are modest HbA1c reductions of 0.5 to 1% in responsive individuals when used adjunctively. Mechanisms include enhanced insulin secretion and sensitivity, alpha-glucosidase and amylase inhibition, gut microbiome modulation, and beta cell protection via reduced oxidative stress. These approaches tend to be better for fasting and postprandial glucose control than for dramatic A1C drops. It is essential to remember that results vary widely between individuals. So we must approach herbal medicines with appropriate caution. Evidence quality is often limited. Many studies are small, short duration under 12 weeks, heterogeneous in preparations and dosing, or conducted in specific regions. Few large, long-term randomized controlled trials exist, and not all agents show consistent benefits. For example, many tea extracts have proven ineffective. Regulation and quality control are major concerns. Dietary supplements are not FDA-approved drugs, and there is significant variability in active ingredient content, potential contamination with heavy metals or pesticides, and risk of adulteration in unregulated products. Safety and drug interactions. While generally well tolerated short term, with gastrointestinal upset being most common, risks include hypoglycemia, especially when combined with antidiabetic drugs, allergic reactions, and rare organ toxicity. Potential CYP450 interactions exist. These are not safe in pregnancy or breastfeeding without close supervision. Major organizations such as the American Diabetes Association do not recommend routine use due to insufficient high-quality evidence. Herbals should never replace lifestyle changes or prescribed medications. Always discuss any supplement with your healthcare provider or pharmacist first. Monitor blood glucose closely and choose third-party tested products with USP or NSF verification. So, optimal diabetes care combines empowered self-management through DSMES and technology, evidence-based pharmacotherapy, prioritizing agents with proven cardio-renal and weight benefits, such as SGLT2 inhibitors and GLP-1 based drugs, including the exciting 2026 options and cautious complementary strategies. A multidisciplinary team, including endocrinologist, diabetes educator, dietitian, and pharmacist, tailors plan to individual needs, culture, comorbidities, and preferences. And ongoing support beyond initial education is critical for sustaining behaviors. Future directions include precision medicine using genomics and biomarkers, curative approaches for type 1 diabetes such as stem cell derived islets and advanced immunotherapies, fully closed loop systems, better orals and multi-agonist, and equitable global access. Practical herbal recommendations, always discuss with your healthcare provider first. Monitor glucose closely when starting or stopping, and then choose verified products and view this as potential adjunctive support alongside standard care, never as primary therapy. So in closing this section, let me summarize our key takeaways. First, DSMES with the ADCES7 behaviors is foundational. CGM, automated insulin delivery, and digital tools make self-management precise and less burdensome. Second, prioritize SGLT2 inhibitors and GLP-1 based therapies, including the 2026 approvals of orforglipron and insulin icodec for their proven cardio-renal and weight benefits. Third, herbal medicines can offer modest adjunctive support of 0.5 to 1% A1C reduction, but require caution, quality products, provider discussion, and must never replace standard care. Fourth, optimal outcomes come from personalized and multidisciplinary care combining education, evidence-based drugs, lifestyle, and informed complementary choices. Finally, prevention through lifestyle remains foundational, while the future holds precision medicine and curative options, especially for type 1 diabetes. So these are our references. On behalf of George and myself, thank you for your attention throughout this presentation on diabetes mellitus management. We hope the information on DSMES, modern pharmacotherapies with their cardiorenal and weight benefits, and the balanced perspective on herbal approaches has been valuable for your practice. Important disclaimer: this is educational information synthesized from Current evidence as of mid 2026, it is not personalized medical advice. The diabetes management must always be guided by qualified healthcare professionals. Individual responses vary, regular monitoring and adjustments are essential. Always consult your care team before changing treatments or adding supplements. By integrating education, innovative drugs, and informed choices, people with diabetes can achieve excellent control, prevent complications, and lead full lives. Thank you once again.